first I'm gonna check your skin. Skin is appropriate for ethnicity. I'm gonna check your scalp. I'm looking for any bumps, any lesions. I don't feel any hairs evenly distributed. I'm gonna check your temporal pulses. Good, equal bilateral. I'm gonna ask you to raise your eyes, eyebrows, frown, puff out your cheeks, smile real big with teeth. Good. Now I'm going to feel your temporal mandibular joint. Can you open and close your mouth? Clench your teeth. Good. I'm checking for any popping or clicking. I'm gonna ask you to close your eyes. Tell me when you feel the cotton.
Yeah.
Okay. Alright, now I'm gonna check your eyes. First I'm looking at your eyebrows, your eyelashes. Everything looks good. There's no redness, no swelling. I'm gonna pull down on your, can you look up, to the left, to the right? Good. Conjunctiva is pink, sclera is white, no swelling, no discharge. Next I'm going to check convergence, accommodation, and extraocular movements. Without moving your head, just follow my finger with your eyes. Good. Checking miss. Everything looks good. Next, I'm going to dim the lights. I'm going to check your pupils. Just look straight over my shoulder. Direct and consensual are equal bilaterally, equal and reactive bilaterally. The next thing I'm going to do is look at the back of your eyes. So I'm going to ask you to look just straight ahead. Try not to blink. Red light reflex present. Medial, disc and cup. Lateral, looking for fovea macula. Good. I'm going to check the other side. Again, just try to look straight ahead, try not to blink. Red light present. Medial, lateral, medial, disc and cup. Lateral, fovea macula. Next, I'm going to check your ears, just looking. They're equal bilaterally. I'm going to feel no tenderness on palpation. I'm going to whisper words in your ears, just repeat them back as you hear them.
1, 2, 3. 1, 2, 3.
Good. Okay, next I'm going to take a look in your ear. I'm pulling the pinna out, back, and up. Good. No redness, no swelling. Tympanic membrane is pearly gray. Other side. Pulling the pinna out, back, and up. Good. No redness, no swelling. Tympanic membrane pearly gray. Good. Now I'm going to check your nose. Your nose looks good. There's no deviation. Doesn't look like there's any trauma to the nose. First, we're going to check patency. So take a breath in. Good. Now I'm going to take a look in your nose. Just going to ask you to tilt up slightly. No polyps, no deviation, turbinance peak. Good, no swelling. Good. Okay. Next, we're going to move on to your mouth. just by looking at your mouth, looking at your lips. Lips look good, there's no lesions, they're symmetrical. I'm going to take a look inside of your mouth. I'm gonna keep your mouth closed. I'm gonna look at your teeth and gums. Gums look good, they're intact, teeth are intact. Open. Looking at your buccal mucosa. Hard and soft palate. Can you stick out your tongue? No lesions, no swelling, no redness. Can you lift up your tongue? Again, no lesions. Good. Stick out your tongue and say ah. Uvula midline, gag reflex present. Next, we're looking at your trachea. Trachea looks midline, no deviation, no trauma. We're gonna check your lymph nodes, preauricular, post, occipital, posterior, to your supraclavicular, no Virchow nodes present. Submandibular, submental, anterior, good. Next, we're going to take a look at your thyroid. Just by looking, there's no enlargement, no goiters. I'm going to give you this sip of this water. If you could turn this way. Look up. Feeling for the Adam's apple here. Good. You can take a sip of water and hold it. And you can swallow. Good. And we'll do that again one more time. I'll tell you when to swallow. Swallow. Good. Okay. You can turn back this way. Okay, next we're going to take a look at your lungs. Skin looks good. Diameter, normal, no barrel chesting. Chest, normal 1 to 2. First we're going to start with percussion. Good. We're going to turn, can you turn this way? Slightly more. Good. Next thing I'm going to do is I'm going to listen. So just take big breaths in and out. Good. I'm going to do the same thing on the back. Take a breath in. last few things. First, I'm gonna check your carotid arteries. Good. Now I'm going to listen. Good. Now I'm gonna ask you to lean forward. I'm just checking for any heaves of the chest or any pulsations. Good. Now I'm just gonna take a listen to your heart. Good. Good. Now I'm just gonna ask you to lay down and place your feet this way. Scoot this way a little bit more. Towards me. Towards me.